Hello, and welcome to our session on prescription for physician burnout. I'm Dr. Siva Pubalasingam, the founding president of the Malaysian Society of Lifestyle Medicine and the chair, Advisory Board, Lifestyle Medicine Global Alliance. Now, the learning objectives for today would be one, determinants of physician well-being. We'll look at stress, burnout, and stress resilience. We look at the role of lifestyle medicine and self-care, and the role of mindfulness in stress resilience, managing and preventing burnout. So what do we mean by physician well-being? So physician well-being refers to the optimization of all factors that affect the biological, psychological, and social health, and the prevention of diseases experienced by physicians that may include mental illness, disabilities, injuries resulting from work hazards, occupational stress, and burnout. Now, in recent years, awareness of occupational distress among physicians and efforts to promote physician well-being have increased. And COVID-19 pandemic brought to the fore the importance of physicians' well-being and its relationship to the ability of physicians to serve their patients and for healthcare organizations to achieve their mission. Now, the COVID-19 pandemic exacerbated pre-existing stresses such as poor work-life balance, inadequate social support, perfectionism, and it was exacerbated by general anxiety, uncertainty, and increased risk exposure. If we look at the determinants of physician well-being, there are many determinants. We can have the social and economic factors, physical factors, and individual characteristics and behavior patterns. Now, today, we are going to discuss about individual characteristics and behavior patterns because these are determinants of well-being that a physician has control over. So some of the individual characteristics and behaviors that are important for physician well-being include diet, physical activity, management of stress, restorative sleep, social connectivity, and absence of tobacco and alcohol abuse. In today's talk, we're going to be discussing or focusing more on stress. Stress, as we know, is the health epidemic of the 21st century. Now, according to the American Psychological Association, in a survey done, indicated that 75% of adults reported experiencing moderate to high levels of stress. And in another study, it was noted that workplace stress was around 70%, and health professionals who work 50 hours or more per week and in night shift were more likely to develop workplace stress. So if we look at the definition of stress, we can divide the definition into two parts. One is the pressures of life, and the second part is how does a person believe or perceive or react or cope with these pressures. And I would say, or rather for me, the second part of the definition of stress is more important because we can't actually change the pressures of life, or sometimes we can't anticipate or change the curveball that life may throw at us, but we can do something about how we are going to react or cope with these pressures. And a person experiences stress when the emotional, physical, or the environmental demands exceed the person's ability and resources to cope. Now let's look at the stress response. We know that the amygdala is the brain's radar for stress. So it scans the surrounding, picks up the stresses, and once it picks up the stresses, the stress response kicks into play. It activates the neuroendocrine and sympathetic pathways via the hypothalamus pituitary adrenal axis and the medullary adrenal sympathetic system. And the end result of these activation is we have the cortisol, adrenaline, and noradrenaline being released. At the same time, the parasympathetic nervous system is inhibited. Now, this leads to an increase in inflammatory cytokines, which are linked to many issues such as aging, abdominal obesity, insulin resistance, endothelial dysfunction, and more. Now, this increase or in stress hormones also lead to a decrease in neurotransmitters such as serotonin, our Mr. Happiness, dopamine, our Mr. Motivator, and GABA. It also uh, promotes gut dysbiosis and impairs our immunity. So in summary, we can say that stress accelerates aging and increases the risk of physical, mental, and emotional health disorders. Now let's look at the causes of stress among healthcare professionals. So what are the specific causes of stress that healthcare professionals experience all the time, dealing with suffering of others? Heavy responsibilities, shift work, demanding job, long hours are some of the causes of stress among healthcare professionals. Now, this leads to anxiety, depression, suicidal ideation, poor quality of life, low life and work satisfaction, poor self-care, and ultimately this can lead to burnout. So what do we mean by burnout? Now, burnout was a term that was coined by the psychologist Freudenberger to describe the symptoms of emotional exhaustion. So burnout indicates prolonged exposure to physical and psychological stress that can result in the deterioration of the emotional functioning of the individual and difficulty of adaptation to their professional commitments. It can present with anxiety and distress and can progress to neurosis. According to the World Health Organization, there are three symptoms that characterize burnout. One, exhaustion. Two, cynicism. And three, reduced performance at work. Now, burnout is linked to many health problems: hypertension, sleep disturbances, depression, substance abuse, and an increased risk of suicide. Now, not only is burnout linked to health problems, it can also ruin relationships and jeopardize career prospects. Now, in a survey of over 7,000 physicians that were assessed using the Maslach burnout inventory, it was found that almost half of them reported at least one symptom of burnout, and physicians were at a higher risk than other workers, and they were more likely to be dissatisfied with work-life balance. Now, in a narrative review by Reed, he also found that half the physicians and one-third of nurses experienced symptoms of burnout. Now, Schoenfeld explored whether burnout and depression were two entities or one. Is burnout work-induced depression? Now, the reason this question was posed was because burnout and depressive symptoms were strongly correlated, and 86% of those identified as burnt out met the criteria for a provisional diagnosis of depression. Now, moving on to physician suicide. Now, though what I'm citing are statistics from the United States, in recent years, Malaysia as well as other countries in this region are seeing an increase in physician burnout and physician suicide. So it's very relevant to us as well. Now, in this article, A Call to Action, it was found that doctors are exposed to high levels of stress, be it personal or professional. There is an increased prevalence of depression, increased risk of burnout, and male doctors have a 40% higher suicide rate than the general population, and female doctors up to 130% higher than the general population. Now, thus far, we have discussed about what stress and burnout can do to the healthcare professional, to the individual. But what does stress and burnout do to the workforce, or how does it impact patient care? So there's an increased incidence of medical errors, and a person who's stressed and burnout can't empathize with patients, reduces the ability to empathize with patients, decreases the ability to connect with patients. Now, no matter how skilled a doctor one is, but if we are not able to empathize with the patients and connect with the patients, we can't be good physicians, or we can't provide good care. So having gone through the issue about stress and burnout and how it's impacting the individual as well as the workforce, how are we going to improve physician well-being, and how are we going to prevent or manage burnout? So the answer lies in physician self-care. Now, for physicians to apply self-care, we can apply the principles of lifestyle medicine, just like we apply the principles of lifestyle medicines onto our patients. So for those of you who are new to lifestyle medicine is an evidence-based approach to preventing, managing, and reversing chronic diseases by replacing unhealthy behavior patterns with positive behavior patterns. Its core components are a predominantly plant-based diet, physical activity, stress management, restorative sleep, social connectivity, and avoidance of smoking and alcohol in moderation. So, as physicians, for us to apply self-care to our lives, we can use the principles of lifestyle medicine. Now, we know that self-care forms the foundation of physician well-being, and the pillars of lifestyle medicine can provide the roadmap for us to engage in positive behavior patterns that is compatible with overall well-being. And risk factors for burnout can be approached through the lens of lifestyle medicine. And these interventions can be done at multiple levels. So if we look at the diagram here, we can address risk factors before burnout sets in. We can address burnout at the source, at the beginning. We can reduce the severity of burnout, and we can um, minimize the adverse consequences of burnout. So the interventions can be done anywhere along the pathway. So how are we going to address the stress and burnout? What are we going to do to reduce the stress or improve our ability to cope? So we need to improve our stress resiliency. So what is stress resiliency? So stress resiliency is the ability to cope with life's challenges and to adapt to adversity. Now, the interesting thing or the good thing about stress resiliency is that these levels can change and we can train ourselves to be more resilient. Now, improving our stress resiliency, is good for us to maintain our well-being in difficult times, because life is like a pendulum. We have good times and we have bad times. Okay, and it helps us to protect against stress and related disorders. Now, before we talk more about stress resiliency, let's just understand a little bit about the structural changes in the brain when a person has burnout. So one of the things that happens is that burnout reduces the connection between the amygdala and other areas of the brain, particularly the prefrontal cortex. And not only that, the prefrontal cortex thins. So the prefrontal cortex is involved in decision making. So I like to say, like, the amygdala is like the army general. So the army general scans the environment, okay, and reports to the president, which is our prefrontal cortex, about any threat that is imminent to our well-being, all right? Now, the president then is supposed to take the necessary action to protect the individual. Now, if the amygdala, the army general, and the president, if the connection is not effective, or the president is slow in responding, then the army general gets agitated, because the role of the army general or the amygdala is to protect the individual. So then what happens? A coup takes place in the brain. So imagine a coup taking place in a country. What happens? There's chaos, there's agitation, there's aggression. All right. Now, a similar thing takes place in the brain. So there's chaos, there's no rational thinking, there's aggression, there's agitation. All right. So now this is what happens if the amygdala runs the brain. Okay. So when we talk about stress resilience, it is about the capacity to activate our left prefrontal cortex, the president, and calm the amygdala or the army general. So how are we going to build resiliency? We're going to reset our mind. So how are we going to reset the mind? Right? I'm sorry, there's some issue with the slide. I'm going to continue now. All right. Okay. So how are we going to reset the mind? All right. If you look at the picture in front of you, do you want to be mindful with the double L, or do you want to be mindful with a single L? Now, what we want is we want to declutter the mindful with the double L and be mindful with a single L. So the objective of resetting your mind is to achieve a state of mindful, which is a single L, all right? So how are we going to do that? So we're going to do that with mindfulness. So what's mindfulness? It is the psychological process of bringing a person's attention to the internal and external experience occurring in the present moment. Now, mindfulness was popularized by Dr. John Kabat-Zinn from the University of Massachusetts. And this mindfulness can be developed through the practice of meditation, yoga, and other training. So what happens in mindfulness? It is basically the art of staying in the present moment and being aware of the present moment, not focusing on the present or the past. Now, it creates the awareness of space between the stimulus and the response. So what we want to do is increase the space between the stimulus and the response so we are not reacting. So when we do mindfulness practices, let's say breathing techniques, yoga, what we are doing is we are giving the monkeys in the brain an activity. So we have many monkeys in the brain, but the problem is the monkeys don't listen to us. We listen to the monkeys. For example, we said, okay, I don't want to listen to that. I don't want to think about that stressful thought or that situation that occurred today. So the monkey will keep quiet for a while. After a while, it'll start nagging at you. But why did that person do that? Shouldn't have done that. And so it will go on until you begin to engage in that negative chatter, right? So when we give the monkey an activity to focus on, for example, breathing, all right? So it is focused on that technique and allows the mind to be free. Now, mindfulness is not just about doing mindful activities. It is also about learning to live mindfully, right? For example, mindful listening. Now, when someone is talking, we should be fully engaged with what the person is saying. It's like when you're listening to me talk today, you should be fully present, listening to what I'm saying. But many a times, we all do this. So the speaker is speaking, but then our mind wanders off to, okay, what am I going to eat after this session? Or what did I do before that? Right? That is the nature of the mind. Okay. And mindful talking, again, when someone is talking, instead of waiting for them to finish and then we talk, sometimes we are so excited. We want to talk as well. And so we cut in when the person is talking. So doing mindful practices is also learning how to live, mindfully. And mindful eating is a very important aspect of lifestyle medicine, in the sense that if we want to eat right, mindful eating will play a big role. So other than, of course, we can feel the taste, we can taste the texture, we enjoy the colors, and we are obviously able to know when we are full. That means when we are able to understand when the satiety center says we are full, instead of continuing to eat. All right. So mindful eating plays an important role in behavior change, in managing weight, for example. Right. So how does mindfulness help us to mitigate stress, or how does it help us prevent burnout? So mindfulness helps us to evoke the relaxation response. So what's the relaxation response? It is the body's natural counterbalance. So what happens is that, if you remember at the beginning of our lecture today, we talked about how the parasympathetic nervous system is switched off when the sympathetic nervous system is active. Now, when the acute stress response is over, the sympathetic nervous system is supposed to be switched off and the parasympathetic nervous system is supposed to be switched on. But what happens is that we have forgotten how to switch off the sympathetic nervous system and switch on the parasympathetic nervous system, because we are always in a chronic stress situation. Hence, when we do these mindfulness interventions, it helps us to switch on the parasympathetic nervous system, hence activating the relaxation response that we inherently have. So this brings about a physical state of deep rest that changes the physical and emotional response to stress. So if we compare the stress response versus the relaxation response, so of course the stress response increases breathing rate, blood pressure, heart rate, and the relaxation response decreases breathing rate, pulse rate, um, blood pressure, improves thought processes, concentration, creativity, and more. Now, there are many studies that allude to how mindfulness can play a role in managing stress and burnout. Okay, there are studies that show that mindfulness interventions can bring down cortisol levels, and that mindfulness meditation promotes better connection between the prefrontal cortex and the amygdala. And in a article in the International Journal of Psychiatry Medicine, it was found that mindfulness-based stress reduction was associated with significant improvements in burnout scores and mental well-being for a broad range of healthcare providers. Now, Laza has done a lot of work on looking at the changes that take place in the brain with mindfulness. And this is interesting because people like to know, if I do mindfulness, after how long can I see some changes? So according to his publication, 8 weeks of mindfulness training lead to an increased activation of the left prefrontal cortex. There's increased gray matter density in the hippocampus, reduced gray matter in the amygdala, and increase in areas that are related to self-awareness and empathy. So that is important. Self-awareness is very important for behavior modification. So it is not just for physician self-care, it is also for patients. If you want them to change their behavior, they need to have awareness. Without awareness, we are not going to go far in making them change their behavior patterns. And of course, we talked about empathy earlier. This is a very interesting article published in the American Journal of Lifestyle Medicine. It talks about lifestyle medicine practitioners implementing a greater proportion of lifestyle medicine experience less burnout. So this was a cross-sectional survey, and 90% of the respondents found that lifestyle medicine positively impacted their professional satisfaction, and that practicing more lifestyle medicine, 43% reduction in the odds of having a burnout. So what are the reasons for this positive impact? One is there's a sense of meaningfulness or sense of accomplishment. That means you get your patients to reverse their diabetes or reduce their weight and keep that weight off, okay? Again, improve patient outcome and patient satisfaction, and improve personal quality of life, right? Okay, we just very quickly, some other aspects of our 6 pillars. Let's talk a little bit about nutrition. So we know that any form of carbohydrates, whether it's complex or simple carbohydrates, help us to promote better mood, right? So we should eat more complex carbohydrates, fruits and vegetables, all right? And avoid simple sugars, because though simple carbohydrates also make serotonin, but it spikes and then it drops very rapidly, okay, so leading to a high and a low, whereas complex carbohydrate help us to maintain our mood, right? And some vitamins like B vitamins, magnesium, right, and omega-3 fatty acids help to blunt the stress response. Now, vitamin C that's found in oranges or amla, it tends to be concentrated in the adrenal gland, right? So can help with reduction in cortisol production, right? So prescription for today, your happiness prescription for today. So eat a variety and multicolored vegetables and fruits, okay, for to promote happiness. So your nutrition can either accentuate the stress response or ameliorate the stress response. So the SMILES trial showed that there was improvements in mental health status after a 12-week Mediterranean diet intervention. And other studies allude to the fact that burnout was associated with increase in fast food consumption, infrequent exercise, and increased consumption of alcohol. Now, other things like other aspects like or other pillars like exercise, of course, increases endorphins, um, ensure that you have adequate amount of sleep, 6 to 8 hours, not only adequate amounts of sleep, the sleep time must be correct as well, okay? Being socially connected, not just being connected on devices, because we are increasingly becoming disconnected in a very connected world, all right? Avoid substance abuse and connecting with nature. So go for a walk surrounded by nature. Connecting with nature helps to reduce stress, improve mood. And not only that, in the tropical countries, if you go outside and exercise, right? This helps to increase your vitamin D levels. And this again has a positive effect on mood, right? And doing things that you enjoy, dancing, singing, all right, are all stress busters. Not only that, doing altruism or doing charity is exercise for the heart. Like we do physical activity for the body. So this is exercise for the heart. And individuals who engage in more hours of volunteering have higher levels of well-being. So according to Emerson, or rather a quote from Emerson, happiness is a perfume which you cannot pour on someone without getting a few drops on yourself. So in conclusion, my dear friends, burnout in physicians has reached epidemic proportions with mounting evidence indicating that a profusion of stresses are taking their toll on physician well-being. Lifestyle medicine plays a key role in promoting physician well-being and mitigating the impact of physician burnout. Moving forward, this will be essential to the success of the healthcare system. So I leave you with this question. Health is a choice. So which is yours? Now, before I end, I would just like to say a few words about the Malaysian Society of Lifestyle Medicine. We are an interdisciplinary professional society founded with the vision to help Malaysians live a healthy life and nurture a country that is free from lifestyle diseases. Our mission is to advocate lifestyle change among the public and to establish lifestyle medicine as central in healthcare. Now, we are affiliated to the Lifestyle Medicine Global Alliance, and annually, we host lifestyle medicine conferences. Our fourth Malaysian Lifestyle Medicine Conference was just over. It was a very successful conference. And the fifth Lifestyle Medicine Conference, the dates will be announced shortly. All right. We also had a post-conference workshop with Dr. Darshan Mehta from the Benson Henry Institute for Mind Body Medicine, Massachusetts General Hospital. And annually, we also host the board certification exam in lifestyle medicine. The last exam was just over. So for 2025, the dates will be announced shortly on the website. Now, some of the significant achievements that the society has had is that with my appointment as the lifestyle medicine expert consultant for the lifestyle medicine for remission of diabetes, which was a collaborative project between WHO and MOH, where we developed the lifestyle medicine for remission of diabetes module and trained and upskilled the healthcare professionals at a healthcare facility in Seremban. And we invited to the Global Lifestyle Medicine Leadership Summit at the Weill Cornell Medicine, Qatar, and gave keynote lecture on the role of lifestyle medicine in revitalizing healthcare. MSLM was also invited to the C20 Integrative Holistic Health Working Group at the G20 India Summit last year, where the society participated in the deliberations and contributed to the formulation of policy recommendation on NCDs. Now, the C20 is one of the official engagement groups of the G20 and provides a platform for civil society organizations around the world to voice the people's aspirations to the world leaders in G20. And the society was invited to present the lifestyle medicine for remission of diabetes at the Integrative Holistic Health Summit at the C20 meeting. Thank you, ladies and gentlemen. I hope you enjoyed the talk. And I would like to take this opportunity to thank MIMS for inviting me